Good afternoon to all the viewers and the public that are present here. We are talking about respiratory diseases like tuberculosis that is presented by Jordi Choes, Alison Mora, Jocelyn Cardenas, and my person, who is Jan Macias. Pathophysiology of the tuberculosis. Tuberculosis is a clinical disorder of the respiratory system that is a chronic infectious disease primarily caused by Mycobacterium tuberculosis, a slow-growing aerobic bacterium. The pathophysiology of TB begins with the inhalation of airborne droplets containing the bacteria, which then reach the alveoli in the lungs. The bacteria are engulfed by alveolar macrophages, but instead of being destroyed, they can persist and replicate intracellularly. This initial infection leads to the formation of a granuloma or tubercle, which is a cluster of macrophages, lymphocytes, and fibroblasts that attempts to contain the infection. The granuloma can either successfully insulate the bacteria, leading to latent TB infection, LTVI, or fail to do so, resulting in active TB disease, as we could see in the image here. In cases of active TB, the infection can spread from the lungs to other organs via the bloodstream or lymphatic system, leading to extrapulmonary TB. Clinical features of TB include a chronic cough lasting more than 3 weeks, and moptisis coughing and other clinical features.
Hello, I will present a bright clinical case. Patient age 24 resigned in Salcedo, Cotopaxi province. University level of education, bachelor degree in administration and business, marital status single, mixed race, non-medical history of interest, family pathology history no report. The disease program began 60 days ago, accompanied by a dry cough, sunlight mobilized secretion. She reported that she has night sweat, fatigue, gradual weight loss, so she decided to go to the private doctor, who ordered bacilloscopies, which report negative. In view of this, the doctor referred the patient to a medical consultation in the Istanbul Health Center, where bacilloscopy tests are performed again with gene experts, which is positive. Taking in account the clinical picture, bacilloscopic test with gene expert test positive, and the checks X-ray present caverns compatible with Mycobacterium tuberculosis. It is decided to start the treatment. Anti-tuberculosis treatment is started based on the tuberculosis control program with first phase. According to weight, it is established to take 3 tablets, a fixed dose of isoniazid, rifampicin, pyramicin, and ethanol.
Hi, my name is Jordi Choes, and now I'm going to talk about tuberculosis in everyday life. Tuberculosis has a significant impact on various aspects of a person's life. Physically, the main symptoms such as a persistent cough, strength, fatigue, and weight loss severely affect the ability to perform daily activities and exercise. These physical limitations can reduce independence, making the person more dependent on others for daily tasks, such as household chores and mobility, impacting their quality of life and self-esteem. In the workplace, the effects of tuberculosis are also important. Frequent medical visits and the need to adhere to a prolonged treatment can lead to a recurrent absences from work. This not only decreases productivity, but can also jeopardize job stability and financial security. Regarding social life, the contagious nature of tuberculosis forces individuals to maintain precautionary measures, such as physical distancing from friends and family. This social isolation can lead to feeling of loneliness and marginalization, and social stigma may create a sense of being a burden to others. The psychological impact of tuberculosis is also significant. Anxiety and depression are common among those suffering from this disease due to worries about their health, fear of complications, and the emotional burden of ongoing long-term treatment. The feeling of losing control over one's life and constant stress can exacerbate these mental health issues.
Hello, my name is Alison Mora. I am to talk about of prevention strategies for tuberculosis. It is recommended as basic prevention measures to avoid contagion and transmissions. It insists that the affected person cover their mouth when coughing or sneezing, and wearing a mask at last during the first 2 weeks after starting treatment. Environmental control measures, adequate ventilation is recommended, allowing natural airflow through open windows. In the vaccinations for the prevention of this disease, in the MCP distributed the BCG vaccine that is applied to all children within the first 24 hours of birth or up to 11 months and 29 days for kids.
Well, as we could see in the video, everything that was spoken here, we could see the clinical outcomes, the prognostics, and the treatment for tuberculosis and all other things. So thank you, and please put your thumbs up in our video. Thank you.